Hello everyone, welcome to sqadia.com. And in the first section of our lecture topic, menopause and post-reproductive health, we will talk about the menopause. In this section, we will talk what is menopause, what are some symptoms of menopause and how it is diagnosed, endocrinology of climactic and menopause, and pathophysiology of menopause organ changes. So menopause is the permanent cessation of menstruation at the end of reproductive life. So it's the time when the menstrual cycles stop. This is usually due to the loss of ovarian follicular activity. So once the ovarian follicular activity stops or ceases, there is no formation of ova by the ovary that leads to menopause. Then in the menopause time, as the changes are occurring, there is a period known as perimenopause, which is the time around the menopause. Those changes occur in female personality during that period. Also, there are usually the mood swings and changes in also the very important change in this time is the cycle regularity is affected. Usually there is a period of absence of 2-3 months, and then suddenly in 1 month there is a cycle. So cycle become very irregular in the perimenopause time, which is the time around the menopause. And then post-menopause is the period after the cessation of the menstrual cycle. Age of the menopause different. This is not some fixed age at which menopause occurs. Usually it's genetically predetermined. If depending on the age at which the mother has menopause, or the sisters have menopause, or aunts have menopause, usually it runs in the family. And the clinical importance of menopause, we will go over that also, because the menopause leads to different changes in the different organs of the body that can affect the daily normal life of the female. This is the, here they mentioned the 7 stages of menopause, and if you get, it's called itchy, bitchy, sweaty, sleepy, bloated, forgetful, and psycho. And so these are some very common symptoms of the patient with menopause. There is itchiness, and there is the mood changes are very. There is fluctuation in the mood pattern. Anger and anxiety is there. So again, this comes under the bitchy feature of the female. And then there is sweaty. The lot of hot flushes are very common, and sweating is very common in the menopause. Usually drowsiness and sleepiness is also common. Females feel very bloated and heavy. Loss of memory is common, and then again psycho means there are periods of time of depression and time of anxiety and time of crying spell. These all come under the heading of psycho. So these just in a lighter tone, these are some of the symptoms of the menopause. Then endocrinology of the climactic and menopause, these are the two terms used side by side for the same purpose. So it's nothing difference between them. So endocrinology, it affects the hypothalamic pituitary ovarian axis is affected, and that affects the estrogen level, androgen level, progesterone, and gonadotropins are affected in the after the menopause or menopause. FSH, LH by the hypothalamic pituitary axis is increased. So there is increased secretion of FSH and LH, but in response to that, the estrogen and progesterone levels are not affected. So these are some changes. There is decrease in the level of estrogens and progesterones, and this after the menopause. So these are some changes that occur in the different structures or organs of the body after the menopause. If you see vasomotor symptoms and sleep disruption, these are all different hormones that are involved with this. There is increase in noradrenaline or norepinephrine. There is decrease in dopamine. There is decrease in serotonin. There is increase in neurokinin B, increase in kisspeptin, and increase in dynorphin, and increased level of cortisol. So these are all the different hormones affect the vasomotor symptoms and sleep pattern after the menopause. Then we have mood changes, mood and cognitive function, which are neuroendocrine activity. There is increase in noradrenaline again. Dopamine is decreasing, decreased serotonin, decreased androstenedione, decreased testosterone, decreased estrogen, decreased GABA. There is also decreased beta endorphin, decrease is allopregnanolone, decreased DHEA, DHEAS, cortisol increase, and cortisol DHEA ratio is increased. So these are the different hormonal changes that are taking place in the different organs. If you go to the bone is affected also after menopause because there is decrease in the level of estrogen. And decreased level of estrogen, there is an increase in the telopeptide of type 1 collagen, an increase in C-terminal telopeptide of type 1 collagen, and there is increase in pyridinoline crosslinks, and there is also increase in IL-1, IL-6, TNF, which is tumor necrosis factor, IL is interleukin, and there is decrease in tumor growth factor. So tumor necrosis factor and tumor growth factor, and there is increase in T cell activation, so bone remodeling. So all these effects leads to, in the brain, different changes leads to decrease in inhibin B, beta, and then there is increase in follicle stimulating hormone, increase in luteinizing hormone, but instead of increasing in estrogen and progesterone, there is decrease in estrogen and progesterone. So main changes that are endocrine changes occurring in the menopause time is there is increase in the secretion of follicle stimulating hormone, increase in the secretion of luteinizing hormone, but in effect estrogen and progesterone are not increasing. There is decrease in estrogen and progesterone level, and that increase in the estrogen and progesterone level after the menopause leads to all different changes that occur in different organs of the body. So this is some pathophysiology of menopause organ changes, and if you see the main cause of these changes here is the estradiol, decrease in estradiol, which is the estrogen. So decreased level of estrogen after menopause leads to the changes in central nervous system and also vasomotor instability. It also leads to changes in urogenital mucosa, and it also leads to changes in heart and the bone. It's very common effect of decreased estrogen after the menopause on these structures leads to significant changes in these organs and leads to different abnormalities and diseases in the female after the menopause. So if we talk about central nervous system and vasomotor instability, what occurs here is there is increase in norepinephrine and increase in serotonin level. So in central nervous system and in vasomotor insensitivity stability, what occurs? There is increase in the level of norepinephrine and there is increase in the secretion of serotonin. Now both of these now increase norepinephrine and increase serotonin level needs to narrowing of the thermoregulatory set point in hypothalamus. Now the thermoregulatory setup point is affected. It narrows the set point in the hypothalamus. This narrow set point leads to hot flushes and night sweat and sleep disturbance. And this leads to in turn fatigue and depression. So what happens in the central nervous system and vasomotor instability? Mainly two things are involved. There is increase in the level of norepinephrine. There is increase in the secretion of serotonin level, and those increase in the level of these affects the thermal set point in the hypothalamus, and that affect the leads to hot flushes, night sweat and sleep disturbance. And once the sleep is disturbed, usually the next day the patient feels very tired and there is depression and fatigue. So these are the changes in the vasomotor system. Then the other is urogenital mucosa. Decreased level of estrogen also affect the mucosal lining of the urogenital system. And these effects are mainly due to the decrease in the synthesis of collagen and decreased vaginal blood flow in the vaginal epithelium. So mainly two effects of decreased estrogen. One is decrease in the collagen synthesis and decreased blood flow in the vaginal epithelium. This leads to weakening of the vaginal wall and decreased glycogen production. Weakening of the vaginal wall cause thinning and easily there are thinning of the vaginal mucosa, and this can cause itching and burning, and all those effects are there. And there is decrease in the vaginal, increase in the pH of the vagina. Increased pH of the vagina above 4.45 usually leads to different bacteria attacking the vagina also. So leads to different infections also. So decreased estrogen ultimately cause in the vagina dryness, irritation, infection, and dyspareunia. Dyspareunia is the painful intercourse. So these are the effects of decreased estradiol in the urogenital mucosa, and finally leading to dryness, itchiness, dyspareunia, and different infections. In the heart, different changes, which is mainly increase in the cholesterol level, increase in the low density lipoprotein, and decrease in high density lipoprotein, and decrease in prostacyclin, endothelin, increase in endothelin, and decrease in nitric oxide synthetase. All these changes can lead to vasoconstriction, or the narrowing of the blood vessel. And when the narrowing of the blood vessel is there, or increased level of cholesterol is there, usually what happens, there is deposition of fat in the blood vessels, leads to atherosclerosis. So all these changes leads to increased risk of myocardial infarction or heart attack. So these are the main changes on the heart after the menopause. Bones, very commonly there is osteoporosis. After the menopause, bones become very weak, very brittle. Deposition of calcium on the bones is affected. There is less deposition of calcium, and all these changes can lead to osteoporosis, and bones are very fragile, so they break very easily. Once the patient or female with after menopause with slight injury or with fall, they break the bones very easily. That's mainly due to osteoporosis. So these are the four main organs in which after menopause there are different changes in these organs, which are central nervous system and vasomotor system. Then there is urogenital mucosa and cardiovascular system, and the bones are affected. Myocardial infarction in heart, osteoporosis in bone, vaginal dryness, itching and irritation in the vagina, and hot flushes and sweating and depression, sleep disturbance in the central nervous system. So you can see that menopause has adverse effect in lot of cases. In different organs are affected, and it adversely affect the life of the female after the menopause. Again, some common symptoms of menopause. We went over most of these already, but there is weight gain, night sweats, palpitations, mean heartbeat is very fast, rapid, or awareness of the heartbeat. Palpitation is awareness of the heartbeat. There are hot flashes, dryness, itching, thinning, tingling. In the joints, there is stiffness of the joint, bone pain, back pain, incontinence is common. Urinary incontinence means there is always feeling that you want to urinate. Then there is dizziness, sleeping, interrupt sleeping patterns, anxiety, mood changes, loss of sexual interest, mood swings. There are transitional menstruations, bleeding between periods. If it's a time of perimenopause, usually this is common. Bleeding between the cycles, or cycles become very irregular in the time of perimenopause, around the menopause. Menopause is diagnosed if there is no menstrual cycle for 12 months consecutively. Usually the menopause is diagnosed. So it has to be 12 months without cycles. Now, diagnosis of the menopause. Cessation of menstruation for consecutive 12 months is the diagnosis of menopause. Appearance of menopausal symptoms, which are usually night sweat and hot flush, is common. If they do vaginal cytology or the study of cells show maturation index of 1085-5. This is the feature of low estrogen. When the cells of the vagina are studied under the microscope, this is the index. 10 is for the basal cells, middle cells, and the top level cells. So this is the maturation index. 1085-5 is for basal cell is the first, then the intermediate and the top level cell. If estrogen levels are low, then the cell growth is affected, index is affected. Estradiol level, serum estradiol level, if less than 20, is the diagnostic of menopause. FSH and LH levels are high, more than 40 is diagnostic of menopause, and 3 values are required. So different tests are done in which there is cytology, vaginal cytology is done. Then there are estradiol levels are measured, level of FSH and LH are measured. Estradiol levels are low, FSH and LH levels are usually high. So that was all about the symptoms, diagnosis, endocrinology of menopause, and what are the pathophysiological changes in different organs after the menopause. Thank you for watching sqadia.com.